Thanks for taking the time to be with us today. On behalf of the five-star accredited Fort Bend Chamber, I want to welcome everybody to the webinar. My name is Mike Dotson. I'm the chairman of the healthcare division for the Chamber. And we want to go ahead and first of all, thank our generous sponsor, Memorial Hermann Sugarland, for all of their support. We're lucky to have their CEO, Melisha Patel, with us today. Melisha, would you like to say a few words and introduce yourself?
Thank you, Mike. I'm Melisha Patel, the CEO from Memorial Hermann Sugarland Hospital and Memorial Hermann Southwest Hospital. And I just want to take a minute and say thank you to Dr. Torres and Dr. Mentor and yourself and the Chamber for holding this event. We're honored to sponsor this event because it's important for us to keep our community informed on important health topics such as this. Over the past several months, Memorial Hermann has vaccinated approximately 113,000 patients to date. And when we include our employees and patients, a little under 200,000. Most recently, with the partnership of Fort Bend County and Memorial Hermann Sugarland, we were able to vaccinate a little over 17,000 community members at Smart Financial Center. And so we strongly support vaccination, but until we have more supply and can vaccinate even more of our population, we must continue to utilize the public health measures that we know have helped us limit transmission, encouraging masking and social distancing, et cetera. And so I'm excited for today's event. And again, just want to thank you for hosting this event.
Thank you very much. I appreciate you. Before I introduce the panelists, I want to call everyone's attention to the chat feature. If you have questions, you'll type them in there, and at the end, we'll certainly leave enough time to address anything that anybody else wants to talk about, I think beyond the topics that we were going to cover. But first, I'll introduce Dr. Jacquelyn Mentor. She is the Director and Local Health Authority for Fort Bend County Health and Human Services, a role which she assumed last February. Dr. Mentor previously served as a Director of Health and Human Services back in 2002, and more recently served in a clinical capacity as a preventative medicine physician in the tuberculosis program. In addition to her service with Fort Bend County, she was a strategic consultant and preventative medicine physician with Harris County Public Health, preventative medicine physician with the Texas Department of State Health Services, Texas Department of Health, also a physician consultant with the Texas Medical Foundation. Beyond that, she's a chemical engineer and worked with NASA and Marshall Space Flight Center. She's board certified in public health and general preventative medicine. She got her doctor in medicine degree from the University of Alabama and an MPH from the University of Texas School of Public Health. So welcome, thank you. Our other panelist is Dr. Alfredo Torres, who is the Herman Barnett Distinguished Professor in Microbiology and Immunology, Associate Provost and Chief Diversity Officer at the University of Texas Medical Branch. He is a peer recognized vaccinologist and has extensive experience in the study of pathogen causing human disease or biodefense-related infection. He is a member of the American Academy of Microbiology, and in Mexico, he is a member of the National Committee of Science, Technology, and Innovation of Vaccines that oversees the implementation of the COVID-19 vaccine. So thank you so much, Doctor. Welcome you as well. So Dr. Mentor, I think we'll just start with you. We'll kind of talk a little bit about the rollout. But first and foremost, let's talk about the three options we have, how many doses are required, how much time between storage, all of that good stuff.
Sure. Thank you. And I would like to, of course, acknowledge that not only have we been great partners with Mike Dotson and AccessHealth in vaccination, but also in testing. So that partnership has certainly proved to be very valuable for all of the people at Fort Bend County. And we absolutely appreciate them coming up to the table, offering their services and stepping alongside of Fort Bend County all the way through this. And we look forward to getting us across the finish line. So the three vaccines that are currently available are the Pfizer vaccine, which was the first one that was received EUA or emergency use authorization from the FDA. The second one is the Moderna vaccine. And the third one, just most recently, is the Johnson & Johnson vaccine. The first two utilize the mRNA technology, and those are 2-dose series. Pfizer has the first injection on the at day 1, and then 3 weeks later, dose 2. And then for Moderna, it is 4 weeks apart. For the Johnson & Johnson, I know a lot of people were looking forward to that one because it's 1 dose. And so it uses a different technology. It uses a technology that kind of hides, and I know that Dr. Torres is going to talk a little bit more about it, but kind of hides the vaccine or the part that works in another virus that's not going to get anywhere near you, but is going to help you in a different way. So storage is a big issue with our Pfizer vaccine. You need an ultra cold freezer, although they're changing some of the recommendations and making it a little bit easier now, but you do need a pretty hefty cold chain for the Pfizer vaccine. And you also do need, there are some storage considerations for freezing and refrigeration on the Moderna vaccine. As far as Johnson & Johnson, that one can be refrigerated for a period of time. But it's still, once it's drawn up and ready to be injected, it also has a short window when it needs to be injected. So all of these have some challenges for us in the real world. We certainly are so appreciative of the public for answering the call. We've done, I think, a tremendous job in getting vaccines to the public within a year's time. And then the public wanting those vaccines and making themselves available to get those vaccines has been a wonderful thing for all of us to see. We wish that we had more to offer to the public. In Fort Bend County, we currently have many partners that are able to give the vaccine when there's enough out there. The county has 4 active sites and also a mobile team as well.
So thank you. Dr. Torres, Dr. Minter mentioned the mRNA technology, and can you kind of give the audience a little bit of an understanding of how that works?
Absolutely. Thank you again for the invitation. So I'm going to go a little bit more basic, trying to give you some elements for you to digest and understand how this technology works. So this technology started about 13, 14 years ago, so it's not a new technology. When we have the first coronavirus outbreak, in SARS, originally SARS, this technology started being developed. And the idea is very, very simple. So we, in our cells, we have our genetic material inside of our nucleus. That's called the DNA. And that DNA is copied, and that copy is going to come out of the nucleus in a way of RNA, and eventually you will make proteins. So the investigators that developed this technology thought that perhaps we can actually get this RNA molecule and then cover this RNA molecule with a nanoparticle. And this nanoparticle is made by lipids and sugars that will allow this RNA to be stable, be injected into the arm of the patients, and eventually that nanoparticle is going to fuse with our membrane of our cells. So the RNA is going to enter in our cells, never reach the nucleus, because in the nucleus we have the DNA, and this RNA is going to make the protein that is the viral protein. And that particular viral protein is the one that is going to go out and induce our immune system to make antibodies. So that's basically the technology that we see with mRNA. And that's the basis of the Pfizer and the Moderna vaccine.
Okay, thank you. So Dr. Minter, I think we kind of talk about, what vaccines have landed here or about to land. Can you walk folks through the process of kind of how all this starts at the federal and then how it sort of trickles to the state and to local municipalities or health systems? How does the flow of vaccine work?
So that's an interesting topic. It certainly has rolled out in a way that may seem a little bit confusing to the public. It certainly has been for us. It's new, it's fast, and also we've had to work through 2 different administrations. One, planning a certain way of rolling it out, and with anything that's brand new and this large, there are going to be some hiccups, and of course there were. And then there were changes, and then And now we have a different administration that is trying to get a number of vaccines out to the public. But yes, it does start at the federal level. This is a federal initiative. All of these vaccines have been completely paid for by the federal government. They are manufactured through the federal government's initiatives. It doesn't involve any of us at the local level or even at the state level. And so at the federal level, they determine how much is being made and where it should go. A lot of that is based on population, of course, but also disease burden and what's going on in the communities. Then the states are told what their allocation will be. And then the states from there make the determination of what will go out into the community. A lot of that depends on what the uptake has been in the community and the community's ability to get it pushed into arms of people waiting locally. What was initially established was that the private sector would, pharmacies, physicians' offices, hospitals would take 85% of the vaccine, and the public sector would take another 15% and just make sure that we were following up for any of people that weren't able to get the vaccine. That strategy kind of shifted pretty suddenly in the middle of this rollout or in the beginning of the rollout, and shifted to what are called these hubs, vaccination hubs. So they decided to, instead of getting the vaccine to many smaller locations, to centralize the vaccine distribution in one location. And people were identified as hubs. I think we could have applied to be hubs, but some of us were identified as hubs whether we applied or not. And so that's what we had in Fort Bend County, and then we were able to respond. I think we were working together to try to make sure we blanketed the county over a period of time. We have 4 distinct precincts, but also we utilized our partnership with the University of Texas School of Public Health to overlay those areas of the county that were most significantly affected and may not have access to large quantities of vaccine. And that is where we decided where we would put our fixed sites and make sure that we had a way for people to come and get their vaccine. And then we also wanted to make sure we had a large site that would be able to handle drive-through, because we know that that's a method of delivery that is very desirable by a lot of people. So that's kind of how things rolled out. That's how we made our decision. We had great partnerships throughout the region that would help us push that vaccine out. Ramping up in a matter of 7, sometimes 10 days was just unimaginable, but we had to do it. We were getting vaccine and we needed to get it into people's arms.
Awesome, thanks. So Dr. Torres, I think we'll just kind of navigate between the two sort of topics here. We talked, Dr. Minter talks about the flow from the federal government down to the state and local areas. If we are talking about the population, you've got 20 to 25% of the population that wouldn't qualify for the vaccine because they're too young. And then you have this population beyond them where we're aggressively trying to reach herd immunity. Can we just talk through the numbers of what herd immunity would be, and what exactly does herd immunity mean?
Absolutely. So basically, for people not familiarized with the term, herd immunity means that you have enough people vaccinated that drops the numbers of virus circulating, or they can be transmitted from person to person. And even though people that are not vaccinated for whatever reason, the number is so small that the other people somehow can protect those people to get infected. That's basically what herd immunity means. And the numbers vary depending of the county, depending of the state, but it's about 70% of people vaccinated in order to get a herd immunity. So, for people to have an idea what will happen, let's say that, we're in Houston, Harris, Fort Bend, we're about 4 million people that needs to be vaccinated, or they qualify to be vaccinated. So 70% of that is about 2.8 million people needs to get vaccinated. So that's the number, that's the threshold number that we need to achieve in order for those that were unable to get a vaccine might be somehow protected by those vaccinated. So that's what we're trying to achieve, and that's what all the public health departments are trying to push vaccination to as many people as possible in all the different communities in the different counties.
Thanks. So obviously all of this is aimed, Doc, at putting vaccine in people's arms. And we have a lot of sort of ways to get folks into the system now. Do you want to talk a little bit about like the registry, the sort of the platform, how it all works for, I guess probably in general, but specific for Fort Bend County? And then, you know, how sort of that process unfolds from registration to, you know, maybe you're on a waiting list, or, you know, what gets you to your ultimate appointment?
Sure, sure. And there's a lot of different ways to get to appointments because there's so many different providers. A lot of people who are already in a healthcare system, a private healthcare system, are getting invitations when that vaccine is available. So that's one way. And they're also, since they're already in a database with that healthcare system, say whether it is Memorial Hermann or another one of our hospitals in the area, or a healthcare system like AccessHealth, or another private healthcare system within in the county. If they're not in that, if they are, they can still go through the public route. But if they're not in one of those systems, they can also go through the public route. So there is Fort Bend County has a waiting list, and we have registration. So we started out with a registration, and because of all of the issues with the online registration, crashing systems, I'm sure people are familiar with that with Harris County, with City of Houston, we thought it was best in our county to open it to a certain number of people and then close it, because we knew we didn't have more than that to actually distribute anyway. And so that's what we did. People were very vocal about wanting to be on a waiting list. It helps them have hope. And so we did open a very simple waiting list. And from that waiting list, we can pull those residents who are on that list. They may have gotten, by the time we get to them, they may have gotten their vaccine in other ways, but they will at least know that if they haven't gotten it in another way, they will eventually get off that waiting list and be offered an opportunity to get vaccine at one of our public locations. In addition to that, we have targeted groups, and our mobile pharmacy is able to go out to some of the groups that are find it very, very difficult to register online. They may be computer challenged. We do have phone lines that are available for them, and we can register them that way. But then there are those who just really have a hard time getting into the system and being even able to get to a site. And those are homebound people or people with no transportation. We absolutely, when people call into our call center, we can address them specifically. We also have been working with our area nonprofits to get those people identified and then take our mobile pharmacy out to them. There are many personal care homes, assisted livings, group homes that were not able to register fully with the federal program, and they're still lacking vaccine. So with our mobile pharmacy partner, those people can get vaccinated. And we've done well over 25, 26 specific organizations and personal care homes that we've just gone out. As soon as they tell us that they need vaccination, sometimes our mobile pharmacy can do 2, 3, 4 in a day. And it may just be 5, it may be 11, it may be 15, but some of these are our most vulnerable people that cannot make it anywhere near our sites, that cannot register, that do need the vaccine. So we do encourage people to call the call center, to reach out to those healthcare partners, nonprofits, churches. We've been working with our faith communities to make sure that we reach those people who are in need, and also who would be at risk of severe disease and worse consequences.
And Dr. Minter, there was a posting in the chat. Is it fbchealth.org? Is that the URL for the wait list?
That is, thank you.
Yeah. So Dr. Torres, right now we kind of hear the terms 1A and 1B, and that's who is qualified currently to get vaccinated. This week there's been some announcements that there's going to be a big push federally to get teachers vaccinated, and hopefully with the use of Johnson & Johnson, that maybe there's more supply to accomplish that. For the folks on, and they'll be watching later, can you kind of give us an idea of what 1A and what 1B means?
Of course. So you probably, the people listening have heard that terms a lot. So 1A and 1B, and they don't explain what basically is. But 1A basically means people in the front lines dealing with COVID-19 patients. So all clinicians, nurses, people working in hospitals, in clinics, that really are the frontline workers in that scenario. 1B is those people that are reached certain age, and those people that have preconditions that it basically classify them in 1B. So 65 and older, or they have particularly medical conditions that classify in those two. Now, with the announcement that happened this week, we understand now that teachers are becoming a kind of a 1C situation, or 1B/C will be a priority list. So you don't have to be in any of the previous two classifications, as long as you demonstrate that you are an active teacher that is in contact with students. So eventually you will get the vaccine.
And just for the folks that are kind of wondering when the teachers will be made available for teachers, how does that work? Does the state say like, hey, it's okay to start vaccinating teachers now, and that goes out to all of the registrants?
I think that's the way. I think different counties, and of course, Dr. Minter has more expertise for Ben, but all the different counties are going to go to their register, and obviously to the different educational districts and schools districts, and see what the rosters are, and then they'll start putting them into the priority lists.
Correct. And that is how we're doing it in Fort Bend. We've had a really good partnership with all of our school districts and several of the private schools as well. And I'd like to remind the public too, it's schools for sure, it's educational systems, that includes daycares. We know that and we actually were vaccinating childcare workers earlier with some of the school nurses if they were taking care of sick children, but didn't have a school nurse, because we did need to protect those that were coming in contact with the children and taking care of sick children at child care centers. But so all of those are included in the Department of State Health Services most recent guidance. I think it came out yesterday at noon. But because of our partnership with our school districts, we had gotten lists of the rosters of interested teachers beforehand, and we had the school districts put a survey out to see who was in the 1B category. So first we had to push for the school nurses, and we had a school nurse day for across the county, and we did that with AccessHealth out at the fairgrounds. And then we had educator days for those educators that fell into the 1B category. But now we are able to vaccinate all educators, anyone that's within the education system and that comes into contact. And so that will become an extra column in the wait list, but also we will be doing targeted outreach, and we have the lists. So we can save in that, say, a schedule of a Saturday schedule of 1,000 patients or 1,000 people that want to have the vaccine, we can actually reserve 300 spots for teachers. And that's what we are doing. We are making sure that we're going to catch them up. I think it's particularly important as we look toward the complete opening up and the thought of not having a mask mandate. We need to make sure that we're protecting teachers. And I know that in schools, we're making sure that we continue to have masks worn in schools. We need to protect our teachers. We need to protect our operations. We want everybody in school. And if we have people who are ill, they won't be in school. And so we really want to make sure that we're giving people who are running our schools and in our schools, we want to give them the most protection possible in these next coming weeks.
So we have 1A, 1B, and now sort of the teacher designation. If I'm somebody who doesn't qualify for any of those groups but I want vaccine, should I register with one? What should my strategy be? So I think people would benefit from knowing that probably like getting on everybody's list is the best thing to do, Dr. Minter?
Yes, I would agree because you don't know who's going to get what and when. And so that's, as I'm saying right now, we're going to reserve some spots for educators, then you may be able to get off of a list faster that's with somebody that's not reserving those spots. So as many lists as possible. And also remember, it doesn't matter what county you live in. It's great to go somewhere that's closer to you because if you have a second dose, you're going to have to go back. If it's one dose, that's one thing. But we get on any and every list you possibly can. And then as long as you're on that waiting list, you'll be called off that waiting list when it's time. What I also would like to appeal to our community, and we have a community that really cares about each other. We've seen that in the partnerships and the collaboration. We have seen that so much in this past year for sure. But I would like to appeal to those who do not qualify, but would like the vaccine in order to travel, in order to congregate, in order to do some things that we want everyone to do. The vaccine will be available for the general public soon, but we do need to take care of those at highest risk. And when you come in for a vaccine with a marginal reason for getting vaccinated sooner, you take the spot of someone who has a higher risk and who has a potential to have a more serious and bad outcome. And so sometimes what will have happen is that a link will be shared or people will show up with, a diagnosis of some medical condition. And they're certainly in the 1B category, but they may not have really suffered with that condition for years. It may have been a one-time diagnosis. And when that person comes, it does take the opportunity for someone who is elderly. We have people in their 80s and 90s who have not gotten the vaccine yet, and the vaccine is limited. We have people with serious autoimmune diseases that have not been able to get the vaccine. We have healthcare workers who are frontline that have still not been able to get the vaccine. And yet, and still, we have other people who are not in those positions who have made their way to the front of the line. And so we appeal to you to please think about your neighbors. It will be here. It'll be here for everybody. And we want everyone vaccinated. We really, really do. We certainly don't want to waste any doses, so we will put them in arms of whoever's available. But we would want to appeal to you to think about those who are at higher risk.
And Dr. Torres, what would you say to folks that are specifically adamant about one of the manufacturers? Should they worry about who the manufacturer is, or should they worry about just getting the vaccine?
Following what Dr. Minter mentioned is important, and I always use this phrase is, vaccines do not save lives. Vaccination save lives. So it doesn't matter that we get the vaccine store if we cannot put it in the arms of patients. But those patients have to be patient because some of them might have to take some time in order to get the vaccine. However, as Dr. Minter pointed out, you can still register. And we want you to register because if one day, eventually those people that were already invited to get the vaccine are not able to attend, you might be able to replace them. And there's nothing wrong with that. It's just because, you were lucky and then you will get the vaccine, and eventually we are trying to reach as many people as possible. Now, the issue with the vaccinations that Dr. Minter pointed out, there is 2 vaccines, Pfizer and Moderna, that require 2 doses. So that's really, really important that if you eventually get one of these 2 vaccines into your arm, you go back and get the second vaccination. And then the way to, people listening might remember this is like when you drive a car, you normally get a seatbelt and an airbag. And the first dose is like the seatbelt. And then the second dose is like a airbag. So the seatbelt might protect you, but you want full protection. You want to have a car that has the seatbelt and also the airbag. So you want to have both. If you're lucky and then you get the other second vaccine, perhaps you hear that the Johnson & Johnson vaccine, the efficacy is a little bit lower, it's 65%. What that means is you're only getting the seatbelt, but you are still protected. So if you get that one, well, okay, you will get protected a little bit lower, but you get protection. So that's what you need to do. You need to understand that concept of 1 dose versus 2 doses.
Thank you. Dr. Mentor, I think maybe just your best guess, because I know this is changing all the time. Over the next month, like where would you see the qualifying sort of requirements maybe pivot or change to?
So I think over the next month, we'll see all essential workers be able to get vaccine. It is a guess. Obviously, I've heard that the governor says soon, meaning March. Well, we're in March. So I kind of wonder, we're in March, what does soon mean? But certainly our frontline, our grocery store workers, our people, our transportation workers. Texas chose to do the health conditions as an age. And knowing that our immune systems are lower over 65, they start lowering at 50 and continue to lower. So that's where the push was, wanting to make sure we got those people protected. Then our hospitals wouldn't be, as vulnerable if we got those people protected first. But now we need to be looking at those who are in the public space and can't get out of the public space. So we've got our teachers. We've got transportation workers, we've got grocery workers, we've got whole, those critical infrastructure people. I think that will be coming very, very soon. And hopefully in the next, 4 to 6 weeks, widely available for many, many, many people.
Okay. So I think now we kind of maybe transition into sort of talking about folks who may be a little hesitant to, I think initially we kind of had like 3 groups. We had people that were a strong yes to start. You had some people that were on the fence and were maybe a little wait and see. And then you had some strong no's. So if we're going to talk to the group that's sort of on the fence and like they were a little bit wait and see, and we've had some time for folks to wait and see. And I heard yesterday, like if you did the math on the amount of the population that died from COVID-19 compared to adverse reaction from the vaccine, it's not even close. It's like 1 in 650 to like 1 in a million. Dr. Torres, can you talk a little bit through the math and kind of what sort of myths may be floating around the public about vaccine side effects?
Of course. So this is very, very important for people listening to try to reach that amount of people vaccinated that can help us to get protected. So there is a group of people in the state that really are reluctant, or they have refusal to get vaccinated for religious reasons, for personal reasons, or historical reasons. So particularly the Black and the brown communities are those groups of people that have refusals to get vaccinated. The Black community, historically, they learn about the Tuskegee syphilis experiment that happened, and there's mistrust of getting studies or anything associated with the medical system. The brown community also, if they are immigrants from a different country, they don't trust the government, or they might not trust the current government, and they might not want to get vaccinated for those reasons. So we need to understand that in a community, we need to educate people. We need to let them understand why it's so important to get this vaccine into their arms, and why do we need to get as many people as possible vaccinated. I think they start seeing numbers, and one of the things that I always use as an impactful number for people listening is, so far we have 70 million vaccines delivered into the arms of Americans. We have 0 deaths related to vaccination, 0 deaths related to vaccination from 70 million vaccines. And we have had perhaps only 2 or 3 COVID cases of 70 million. So that's shocking. If you compare that, we're reaching 400, or now I think we passed 500,000 deaths from COVID cases in the United States. So the numbers does not even get closer. Either we keep having deaths due to COVID if we continue this path, or we get vaccinated as many people as possible and we drop the numbers to 0. So those are the two numbers that we need to keep in mind.
So I'm going to play devil's advocate a little bit. So that's great now, but you can't tell me what's going to happen to me in 10 years.
Absolutely.
Very true. I mean, this is what we know. It's a short-term process going on right here, and we're learning as we go. But I think, as Dr. Torres and many other vaccinologists have said, this is unprecedented, but it's not new. It's unprecedented in the success of these vaccines, but it's not like these vaccines were started to be developed on March 1st of last year. These have been in development for decades, and it just took the world having laser focus on trying to get these vaccines out here, putting funding and resources behind what was already close to getting it over the mark and getting it over the mark soon. And so I tried to, so for the African-American community, I try to look at some of that hesitancy that Dr. Torres talked about historically, is not to let what historically was very injurious and dangerous for people do a double danger for you now. You know, don't carry that in and keep that history from harming you now. Go ahead and get a vaccine that is good for you. We also try to think about the fact that this is a vaccine that's good, and it's just delivered quickly. So like doing it by FedEx Express instead of by bulk mail, okay? But it's still the same package, and it's a good package. So that's another analogy I try to use. Now, I know that it's difficult for communities that are wondering why so much data has to be gathered and what that's going to be used for, when it's hard to trust what things have happened to people in the past if they know more information. And we try to remind people this is health. This has nothing to do with anything else but your health. And so the information we're gathering is to make sure that we know how to keep you healthy. And if there's additional doses that need to go, that we can provide that to you. Also helps to keep the numbers that Dr. Torres is talking about. If we get that information, we know who's having a side effect and who's not. What we feel like our side effects are actually your immune system responding to the vaccine and working well. So these are positive. I know that there are people that have autoimmune diseases that have a blunted response because they can't mount that response. And so they kind of sail through, and our older people sometimes don't have the same kind of response because their immune system is blunted. But people that have a robust immune system, they're going to respond to that vaccine. And so those are the things that, that they're going to feel and we want them to feel. But we need that information to make sure that we understand what's going on with the vaccines when they get in your arms, not for any other reason. So we want people to know those things so that they're not hesitant about taking advantage of a very, very good set of vaccines. And even the third vaccine that has some, decreased efficacy as far as symptoms, it has wonderful efficacy for hospitalizations and deaths. Those two endpoints are just as good as the others. So they're equal in that way. So we want to make sure that we're giving that information out as well.
And I want to add a little bit more about that because it's very, very important. Your question is critical because people might say, what is going to happen to me? Well, for us that we develop vaccines, we know that there's two critical things that when you develop vaccines, there is an immediate response to the vaccine. That means when you get the vaccine, within 24 hours, you might get some side effects. And then we watch those. And I'm not going to lie, if you get the Pfizer or the Moderna vaccine, 80% of people will have some type of effect, meaning fever, headache, muscle ache, those kind of things, but they last 24 hours. So you have to be ready to potentially get those side effects, but that's part of your immune system kicking in and helping you to get protected. And the second one is the later effects. Normally those later effects happen within weeks of receiving the vaccine. And we, that people that develop vaccines, we watch for those effects and want to know what is happening. there is no data, strong data that supports that, years later, because you got a vaccine when you were a kid, you will develop some syndrome. There was this paper that was published several years ago that were some association with autism, which was disproved. And, the scientific community has actually shown that that paper was a lie. But, unfortunately, that paper stick around and is still people citing that paper, even though that's not true. So that's what people need to remember. There's immediate effects and effects that happen within 2 weeks. And if you have those effects, go to your physician, and the physician will prescribe you some antihistaminic or anti-inflammatory, and then you will be fine.
So thanks, really good both. Dr. Minter, I know you've worked, pretty much every day at the sites and have sort of functioned in sort of a medical capacity there, just kind of watching folks for the 15 to 30 minutes after the vaccine. I know it's not super statistically significant, but anecdotally, like what's the worst you saw?
So we have actually only seen one that we can call for sure a reaction, and all the vaccines that we've given, just in our partnership, what we're doing with the county, we've given 58,000 vaccines, doses. And of course, it's the first doses that you're really concerned about as far as anaphylaxis. And we've watched everyone, and we've seen one, absolutely one, who got hives, and we absolutely had, and that's a rash that's a rash that shows that there's a mounting allergic response that could be dangerous. She had no trouble breathing, nothing like that, but still, we watched her, and then we sent her to the emergency room. We had another that was a potential, so that gives us two, one for sure, and one that was a potential. Of the others that we have had to transport, lots of people have anxiety about getting shots. And so we've seen that. We've seen certainly people have some issues with just seeing a needle has been frightening, but that's not based on the actual injection. We have, for people who are concerned about that, we have EMS on site for every first dose. We have our crash kit for all of the second doses as well, and medical personnel overseeing. And so we make sure that we are watching people very carefully when people are, just having, they're a panic attack, or they didn't eat enough and they're lightheaded. We have people there the whole time to make sure that we're taking care of people, so that we don't want people to be concerned about it any more than they would be at their normal clinic and what they would need there. But seriously, that is all we've seen. I'm always asking, because we have EMS on site, I'm always asking, did you transport? Yes, 5, but what was it? And invariably they're not for vaccine. And also in the screening, when people register in the screening, if they have had a reaction to an injectable in the past, that's a conversation that they want to have with their physician, and they can get the vaccine at their physician's office, not at one of our mass vaccination clinics, because we want them to have that discussion, to know the risks and benefits for them, and to be able to manage those well in an inpatient setting. So we absolutely are looking out for people that way. And, we have everything ready if we think that we have somebody that might have an issue. And we've actually at the nurse's station turned a couple of people away after they described some of the things that they've had in the past, because we don't want them to have an event.
So we've talked a little bit about equity, and we've got about 15 minutes left. And I think that's going to be critical. I mean, obviously we've got all of this pent up demand right now, but at some point there will be enough supply to satisfy this pent up demand. And then we're going to have this large group of the population that is hesitant for reasons that have sort of been alluded to or identified today. So let's talk first about trusted sources. So Dr. Torres, how important is it to get your information from a trusted source, and what is a trusted source?
Absolutely. So, the people that are listening, I hope you're trusting us that we're telling you the truth. So have to go and listen to people that, really works in the front lines and understand what is happening. It's critical. It's critical that, we work together with the community to educate them and make them understand how important is that the majority of us get vaccinated. And what Mr. Dotson is mentioning is what people call the vaccine deserts. What that means is within a county, you will have areas or communities, could be Black or brown communities, that do not get vaccinated. If this community is too large, or this is a desert that occurs within a county, and if you understand the concept of having this mass vaccination, if you get this community that the majority are not vaccinated, unfortunately, the transmission of the virus in that community is going to start circulating and eventually going to the rest of the county. So what you want to really have is the county, and then you can have enough vaccination that covers all the county. So, talking about the 70%, that you do not have those areas that do not have any vaccination. So how can we reach to those areas? Obviously, pastors, priests, leaders in the community that understand the value of getting vaccinated, because you want to go back to normal. You really want to go back to reopen the business. You really want to go back to have sports and different events back to normal. So in order to congregate in large groups, you really want to have people vaccinated that can actually help you to protect you. So that's what we are trying to achieve.
And Dr. Minter, you had mentioned earlier that the county partners with UT School of Public Health to get real-time data and sort of knowing where populations are getting the vaccine, but moreover, where populations aren't. So as we kind of move to that sort of stage, how important is data, and how mobile does the county need to be to sort of almost at a granular level address maybe the disparity that's happening?
Oh, Mike, yes, you bring up two great points. We can have all the mobile units we want, but I can tell you, if we don't know where to go, we will end up going to the people who can ask us fastest and, and get it. And we'll still be going to the same places, because they'll send us emails and they'll make sure that all of their community gets taken care of while others will not. So getting that data to show us where we're not having uptake and coverage, because even interestingly, even when we're registering or pre-registering people and then saying that we're going to identify zip codes that historically have not had good uptake, we find there's not even enough in our registration. There's not enough people that have even registered for us to target those populations. So we do have to get to that granular level and partnering with those trusted sources, the schools, because people do trust the coaches at the schools, the principals at the schools who have educated their children, the faith communities where they've had Boy Scouts, Girl Scouts, Boys and Girls Clubs, and church events where people who have buried those who have died of COVID, who have sat alongside them. Those are some trusted sources. And we've had a lot of those faith communities roll up their sleeves and intentionally, get out there in front of people and say, we're getting the vaccine. It's important to make sure that we cover our community. And those essential workers are sometimes those that, will get it back out and spread to the rest of the community, because they're at the front lines. They're working in our hospitals. They're working in our schools. They're working in our transportation. And if we don't get those workers in their community, if we don't make sure that they trust the vaccine, we all have to trust it in order for it to help us all. We will continue, as Dr. Torres said, to have not only that part of the community affected, but it's not as if we're isolated. We have jobs in other fields. And so we need to make sure that we are protecting ourselves as an entire community in the greater Fort Bend area and in the greater Houston area, for our businesses to make sure that they are friendly and promoting vaccination and opportunities for their employees is a great thing. we sit on, do a lot of education for the business community, and they did step up and offer certain places for us to partner. And we love that, because that also shows a united front in getting our community vaccinated.
So, Dr. Torres, Fort Bend is extreme in diversity, right? We've got like the most culturally diverse county in the country here. So, and a lot of folks don't speak English. How important is it to be purposeful in the messaging and being cognizant of non-English speaking folks, and how we deliver this messaging, and how creative do people need to get to get the message out there?
Absolutely. That has been a big problem for, the state of Texas, period. So we have a large population of people that do not speak English, or they do not feel comfortable communicating in English, or they do not follow the news, TV, radio in English. So we need to partner. We really need to partner with, Spanish-speaking TV, radio, newspapers, local newspapers that can reach to those communities and try to work with those. Obviously, we need to partner with the schools. Dr. Minter mentioned it. People trust the coaches. We need to, the principals. We need to reach to those, people that can speak Spanish and they can be trusted in the community to actually reach those communities. One thing that people need to understand is not that this is not an issue about trying to target a particular set of the community. We all are part of the community. They all work in our hotels, in our restaurants, in our bars, in different grocery stores. So if we don't get those people vaccinated, virus is going to continue being circulating. So I ask the people in the Chamber of Commerce that you are a powerful ally to public health to actually get your employees to get vaccinated, because in that way you can actually get your business back to normal. This is an economical issue. If you get your people vaccinated, eventually you will get back to start producing, the goods for the community.
Really good, thank you. We're kind of winding down, so I'll give you. Well, let's do this first. I'm just do kind of like rapid fire. I've got a list of, I Googled COVID-19 vaccine myths, and jump in however you want. COVID-19 vaccine affects fertility.
No, as far as I know, no, I don't think so, because if you are concerned about the RNA that is in the vaccine, it doesn't go into the nucleus of the cells, so no.
Okay. I've had COVID-19. I don't need the vaccine.
So we want you to get the vaccine. Your vaccine will act as the booster. We absolutely want you to get the vaccine, and you know that there are variants out there, and we want to make sure you've got the best protection possible.
The vaccine can give you COVID-19.
No, because it doesn't have the entire virus. As I was mentioning, it's just a piece of the virus that produces a protein, one of the components of the virus. So there is no chance that you can get COVID-19 with the vaccine.
The vaccine changes your DNA.
No,
Yeah.
we already explained that.
Then my last one. I've got 2 vaccinations. I don't need to wear a mask.
You need to wear your mask until more of us are vaccinated. You must wear that mask until more of us are vaccinated.
All right, so we got about 2 or 3 minutes left. So what I'll do is I'll let you guys each have a closing thought. And I think if we can kind of just tie in the idea of how close we are to summer, and how important the next 90 days are to achieving the results that we all want to achieve, I think that would be well served for the audience. So Dr. Minter, I'll let you go first.
Okay. Yes, thank you again for having me. And great way to wrap is that we are at the end of a year. Today, actually, I remember very clearly making the announcement that we had a laboratory confirmed case of, well, presumptive at that time of COVID-19. First case in Fort Bend County, first case in Texas. And it was actually March 4th of last year. And so here we are a year later with amazing accomplishments and we're so, as you mentioned, Mike, very close. We need to continue. A few more months it's going to go by so fast. And actually it's going to be weeks. It's really going to be weeks. We're starting to see ourselves turn the corner. If there's another surge, we should be able to blunt it. If there's a mild spring surge, we should be able to blunt it if we're continuing to hammer on the vaccines. We're at the cusp of getting many more vaccines into the community, and now we're positioned to push those out. We need people to just hold on. It would not be wise with spring break coming up, opportunities to travel, that we let our guard down without wearing masks and without distancing. We really need to stay apart. There are still cases out there. There are variants out there. We need to do the work. We've been doing the hard work. We don't want to negate that. So again, get vaccinated when you can, stay on those lists, keep your masks on, keep washing, keep doing the good work of distancing. We'll get there. We'll get there sooner than you think.
Really good. Dr. Torres?
Likewise, thank you very much for the invitation. So I just want to invite people listening and the people representing the Chamber of Commerce to be part of the history and get vaccinated. Join us in this effort to get as many people possible vaccinated with the COVID-19 vaccine and get rid of this virus. And I'm challenging you, Chamber of Commerce of Fort Bend, to do the following. Can you break the record and be in the county with more vaccinated people in the state of Texas? I know, you can challenge other Chamber of Commerce and see who can win. So I'm hoping that you're listening and you can actually break the record. Thank you.
Really good. All right. So Ryan, I did see the chat. Just have Brian email me directly. I'll take care of those two issues or questions rather. The chamber wanted me to call attention to some upcoming events that they've had or are going to have rather. Tuesday, March the 9th at noon, there is a business and professional division event called Exploring Global Markets Resources for Exporters in Fort Bend County. And then on the 11th, from 8 to 9, the infrastructure division is hosting Commissioner Annie Myers with some updates. End of the month on the 25th, from 11:30 to 1:30, the government relations division is doing a virtual presentation, the 2021 State of the City of Sugar Land. If you want to check in on those or more events, you can go to the Chamber's website, which is fortbendchamber.com. I want to thank everybody for watching, and certainly those that will watch later. Thank you, thank you. Thank you, the panelists. Y'all did a great job. Unbelievable, good information. It went really, really fast. This email is going to be, the webinar will be recorded and it'll be emailed out here pretty quickly. So with that said, everybody enjoy the rest of their day. Stay safe. We'll see you next time.
Thank you so much, Mike. Thank you, Dr. Torres and Dr. Mentor. Amazing conversation. Y'all enjoy the rest of your day. Bye.